Hello, everyone. Thank you for joining us for our presentation today. My name is Cody Cox. I'm president of Cox Global Associates. Today, we are here to discuss Social Security and Medicare. I also have joining me our local expert, Lee Ammer, joining us to give you the ins and outs of these programs and to provide you with further support should you need it in the future. So why are we providing this presentation today? Well, I'm sure some of you have seen the news recently. The One Big Beautiful Bill Act passed, and that's a recent law that passed July 4th, and some items included in the law pertain to Social Security. So I'm going to go over some of those items right now. The first change is there's now a new deduction that's effective in 2025, and it'll go through 2028, where individuals who are over the age of 65, or 65 and older, may claim an additional deduction of $6,000 each. And this deduction is on top of your current deduction. The deduction does phase out for taxpayers with modified adjusted gross income over $75,000 or $150,000 for joint filers. Your benefits could still be taxed essentially if this deduction doesn't fully eliminate your tax liability. This reduced tax collection does reduce the pool of funds used to fund Social Security benefits. Currently Social Security benefits are 50% taxable for seniors with over 25% of annual income, or $32,000 for couples, and 85% taxable for seniors with over $34,000 of income, or $44,000 for couples. That 50% is deposited into the Social Security Trust Fund, like a savings account, and the additional 35% into the Medicare's Hospital Insurance Trust Fund. With this new deduction, only about 12% of seniors will pay taxes on their Social Security benefits, according to the White House Council of Economic Advisors analysis. This is a huge improvement from in 2024, when that was approximately that 40% were paying taxes on Social Security. Some other items related to Medicare include eliminating Medicare benefits for certain groups of lawful immigrants. And you might ask yourself, do these changes affect your retirement planning? Well, not at this time. Social Security benefits will be adjusted for inflation, and the tax deduction would not directly change the retirement plan we would create for you. We would continue to emphasize the importance of having multiple sources of income during retirement, not just your Social Security. I think a big question many people have when it comes to Social Security is, will it last or will it run out at some point? Well, the Social Security Retirement Fund, that savings account I mentioned earlier, is projected to be depleted by around 2033, should things remain as they are today. This is the point in time when total workers' Social Security tax payments won't cover benefits alone, and the Social Security Retirement Fund would be zero. Our current tax collection could cover about 77% of full benefits, according to the Social Security Administration, so we obviously would need a solution to cover that remaining 23%. One little kind of factoid that would maybe help to benefit the situation is the peak number of retirees does occur around year 2030, so that alone could help the issue, but other actions obviously need to be taken. So what are some of those actions that we could take, or would it be possible that might help the situation? So let's go over some of those possibilities. First of all, you could increase revenue through higher payroll taxes and eliminate the earnings cap. Right now, that earnings cap is $176,100 are not taxed for Social Security. So any money someone makes on top of that $176,100 is not taxed for Social Security. Another solution could be reducing benefits. I know that's not something anyone wants to hear, but that's just an option of something they could do to kind of help not deplete that Social Security fund. Another option would be raising the retirement age. And then another option might be to invest a portion of the Social Security Trust Fund differently to boost returns. Right now, the fund currently invests in U.S. Treasury securities, and a 20-year Treasury bond at the moment is currently paying around 5% interest. So if it's something to where they think they need to make more money, they might choose to invest in some other product that makes more. And the last way that you could do this is reduce financial waste, fraud, and overpayments. That's something that's also kind of been in the news recently with Doge. So that's something they are currently already actively doing. So we'll have to wait and see just how much of an improvement that makes for Social Security. So those are the hot items we've heard in the news lately. But again, we want to emphasize the importance of planning for retirement and creating multiple sources of retirement income. If you can do this, this kind of news doesn't have to make you nervous, right? So if you can, plan accordingly, make sure you're set for retirement, then if they choose to do any of these things like raising the retirement age or reducing benefits, you don't have to worry about that because you're already set for the future. So without further delay, let me introduce Lee Ammer. Lee is a registered Social Security analyst as well as a life and health insurance agent, and she helps individuals like you make the best decisions about Medicare and Social Security. So I'll turn it over to Lee now.
Hello there. My name is Lee Ammer, as Cody had said. A little bit about me. I've been married for 10 years. I've worked in corporate America in the benefits office or as a benefits manager for the last 20 years in corporate America. And I've handled groups anywhere from 350 to over 5,000 employees. I'm also a licensed life and health insurance agent. I've been a business owner of OG Benefits, a woman owned business, for the last 7 years. And I'm also a registered Social Security analyst, which means I've gone through training specifically for Social Security benefits and optimizing those benefits um, for employees or for those that would like me to do that for them. So today we're going to talk about Medicare first, and then we're going to go into some Social Security gotchas. So let's talk about first, what is Medicare? Medicare is healthcare coverage for those 65 and older. It could also be for those younger than 65 if they have a disability and have received Social Security disability income for at least 24 months. Could also be for those that have had ALS or a kidney transplant. Social Security benefits are different from Medicare benefits. Even though you go to the Social Security website to sign up for Medicare, they're two different things, and they don't both have to start at the same time. So it's real important that you understand that Social Security benefits are actually the payments that you're going to start receiving, usually after your full retirement age or older. And then Medicare benefits are actually the benefits that are going to help you cover your medical care. So that would be going to the doctor's office, having any kind of outpatient testing and labs, all that kind of stuff. That's the difference between the two things. And I just want to make sure that everybody understands that there are two different benefits, and the benefits can start at different times. So we're going to start with the different pieces and parts of Medicare. So Medicare has Part A, which is hospitalization. Part B is doctor and outpatient services. And then Part C, like CAT, is for Medicare Advantage plans. And that encompasses both Parts A and B, and sometimes a Part D, which is your drug coverage. Some Medicare Advantage plans have drug coverage, some do not. It just depends on the plan you pick. I want to talk about when can you enroll in Medicare. So there's actually several times you can enroll. You can enroll at the initial coverage enrollment, which is 3 months before your 65th birthday, the month you turn 65, or 3 months after you turn 65. And it's real important that if you have any kind of health issues, that you are very careful about what you choose during this initial enrollment coverage, because the initial enrollment coverage period allows you to get what we call guaranteed issue, which means you don't have to answer any medical questions. So you can get the guarantee issue at the initial coverage when you first turn 65. You can also get guarantee issue when you have a special enrollment. So for example, you stop working and you retire from your job, and then the job does not have a retiree plan. So at that point in time, you can get into Medicare, and you would also have guarantee issue for Medicare at that point in time. There's also annual enrollment, and that's October 15th through December 7th each year. And this is for people that are enrolled in a Medicare Advantage plan. It gives them the option to be able to change plans or stay where they are, just depends on what their needs are. And then there's also open enrollment, which is January 1st through March 31st each year if you're enrolled in a Medicare Advantage plan. You can only take advantage of open enrollment in January if you're enrolled in a Medicare Advantage plan. The special enrollment, like I was saying before, if you have certain events that happen in your life, so that would be when you retire and you leave your group health plan, maybe you've moved from one state to another or one part of state of Texas to another part of state of Texas. Usually it doesn't count if you move from one side of Houston to the other side of Houston because the plans are usually county based. And so in most cases, you may change from Montgomery County to Harris County or Fort Bend County to Harris County or Harris County to Fort Bend, or maybe somebody goes to Galveston County, something like that. And those are all metro counties. So there's going to not be really a need to change your plan then. But if you change from Houston and you move to Dallas, or you move from Houston to Austin, those types of moves will allow you the opportunity to change plans at that point in time. So we'll go ahead now and we'll start talking about Original Medicare and what it is and how it works. So as we talked about it before, Part A is hospitalization, skilled nursing care, but this is very limited to certain times when you have skilled nursing care. This is not custodial care. Unfortunately, there is no coverage unless you have long-term care insurance that is for skilled nursing care. This also includes hospice care and home health care. And once again, this is also limited. The skilled nursing and the home health care are available to you immediately after you've had a hospital stay of 5 or more days. Part B, Original Medicare, covers outpatient services, doctor's visits, durable medical equipment, mental health services, and then limited home health care as well. Once again, after you've had a hospital stay. So what's not covered in Medicare? Unless you sign up for a Medicare Advantage plan, you have no dental, no glasses or contact coverage, cosmetic surgery, acupuncture, hearing aids, and then unlimited long-term care or custodial care. These things are not covered in Medicare. So if you haven't already thought about a long-term care program, that might be a time to think about it before you turn 60 to 70. Somewhere in the year, in those 10 years is a good time to think about it, or earlier if you can. So what you pay for in Part A, if you've worked for 10 years or 40 quarters in the US, you have no premium, like I said before, and you may also qualify because of your spouse working history. You get the first 3 pints of blood at no cost, and you have in-hospital care for days 1 through 60, and you have a deductible of $1,676 for 2025. Now that amount increases each year for inflation. Then you pay nothing until day 61, and then day 61 you have co-insurance or co-pays of $419 per day through day 90. Day number 90, you have $831 copay for another 60 days. And then you have a 60-day reserve. And this is only for your lifetime. So once you've exhausted 150 days, you really have no hospital coverage unless you have a supplement or Medicare Advantage plan. Skilled nursing, like I said, works after a 3-day minimum hospital stay. And for days 1 through 20, you pay nothing. Days 21 through 100, you pay $210 a copay per day. And days 101 and after, you pay all the costs. On Part B, you do have a monthly premium. So if you have not started Social Security and you want to get on Part B, you need to pay $185. I apologize, there's a typo there. That should be $185 a month in 2025. In 2024, it was $175. So if you've not started Social Security, you have to either allow Medicare to come into your bank account every month and pull that $185, or you can pay a quarterly payment and write a check to Centers for Medicare and Medicaid Systems. Those are the only two ways, unless you're taking Social Security, that you can pay for your $185 a month. And it's really important to remember to pay that. I highly recommend that if you have any way to set up an auto pay in your bank account and let CMS come in and pull that $185 a month, that you do that, because I have had clients that have called me in a panic and say, I don't know what's wrong. My Part B isn't working anymore. More than likely, something has happened and they've forgotten to pay their $185, and they may be in arrears up to 6 months. And this may be the 7th or 8th month that they go to the doctor's office, and all of a sudden they get an ugly surprise when they go to check out, because the doctor's office says you don't have Medicare anymore. And so they have to pay that bill, and then they call me panic stricken because they don't know what's happened to their Part B. So just keep that in mind. Keep in mind that most cases, Medicare pays 80%. You pay the remaining 20%. And it's important also to remember, if you're on original Medicare, there's no maximum. So as long as you're getting services, you will continue to pay that 20%. I want to make sure everybody understands that. Medicare does not pay 100%. You pay 20%, and you will continue to pay 20% as long as you're getting services. Many people are under the impression that Medicare covers the whole cost of care, and unfortunately it does not. There are two other parts of Medicare, and that's Part C, which is a Medicare Advantage plan that are offered by private insurance companies, and they cover the same parts of original Medicare, Parts A and B, and they may offer drug coverage as well. And then they also have added coverage for dental, vision. Some have transportation, some have over-the-counter credits. It just depends on the company you decide to sign up with. So Part C is actually a substitute over Parts A and B and your 20%. But you will be paying copays every time you go to the doctor. So it works kind of like your group health plan does that you may have or you may have had, because you'll always be paying copays. Part D is prescription drug coverage. Once again, this is offered by private insurance companies, and each company has its own formulary list. And so what I do and what my team does is we take the list of medications that people are taking, and we run them through a computer program to find the best price and get all or most all of the medications covered at either a zero copay or a minimum copay. But each of those policies all have a monthly premium. So I want to make sure that you understand you have some money to spend each month once you get on Medicare. You'll have the $185 for Part B and your Part D. And if you do nothing more, you're going to at least have the Part D and the $185, and then your 20%. So you can see there's a lot of different things you have to consider. Medigap or supplement coverage is a different insurance that goes with original Medicare. All companies offer the same benefits. I was just working with a client yesterday, and he had explained to me that his friends were all on one particular company plan. And I said, well, they're a different age than you. And he said, yes, they're a little bit more mature than I am. And I said, well, it could be that right now there's another plan that may be priced better. But once you get on a Medicare supplement plan or Medigap plan,
you want to stay on it, because when you first turn 65 or you first stop working from a group health plan, you have the opportunity to get what we call guarantee issue. And it's very important, because if you move on down the road and as things happen and we mature, stuff happens. We have high blood pressure. We could have a heart attack. We could have a hospital stay that would be not very lengthy, but the fact is we've had a hospital stay. All of those things do affect the premium you pay. And in some cases, you could even be turned down. So it's very important to think about whether or not you want to have supplement or advantage or just stay with original Medicare. With the supplement coverage, there are no networks. So if you are diagnosed with some dread disease and you want to go to the Mayo Clinic, or you want to go to MD Anderson, or you want to go wherever, as long as that doctor or facility takes Medicare, they will accept your supplement coverage. There is no networks. The network question goes out the window, and you just have to make sure that the facility or the doctor will accept Medicare. So this is a different cost, because you still have to pay your Part B, you still have to pay your Part D for drugs, and you would have to pay a monthly premium also for your supplement or Medigap coverage. But you'll see this little guy in the corner here. He's got his golden ticket. And we call this plan our golden ticket because my husband's a little bit older than I am, and bless his heart, he's not the most graceful person. And in 1 year, he had his hip replaced, broke his wrist twice. He had some other complicated illnesses, and he spent over $250,000 at Medicare prices. But because he has a supplement, we only had to make sure he paid his monthly premium each month. So that's what we call this, your golden ticket plan. So there are some gotchas with Medicare. If you miss enrolling when you're supposed to, for example, many people did not realize that they had to have a Part D for prescription drug plan. And people still today don't understand that when they turn 65, they still have to have that Part D. So they can either have Part D through their employer if they're still working, or they have to have a standalone Part D plan. If they enroll in Medicare and don't enroll in a standalone Part D plan or Medicare Advantage plan with a Part D, they will have a penalty of 1% each month that they do not enroll in a Part D plan. And I have some clients right now that have just a $6 or $8 penalty, but that's $6 or $8 every month for the rest of their life. So it's really important to make sure you don't miss those deadlines to enroll, and especially Part D. Even if you have no medication needs right now at age 65, you still have to sign up for a Part D. In 2025, we have 2 plans that have a 0 premium. So I recommend those 2 plans for someone that's not taking medication, because that way they're still having a Part D coverage and they will avoid the penalty. We have not seen the 2026 plans. I don't know if we're going to have any 0 premium plans yet or not. Hopefully there'll be at least one left out there that we could do for someone who doesn't have any medication needs. But there is a need to have that Part D. You want to be sure to check your coverage annually, particularly your Part D if you're on a Medicare Advantage or a Medicare supplement, or if you're doing just original Medicare. Your Part D formularies can change each year, and so do your medications. So you want to make sure that your formulary covers your medications. You can enroll in a new Part D from October 15th through December 7th, and that new coverage begins January 1st each year. So you can reach out to us or reach out to a licensed agent to have them help you verify that your medications will be covered on your new plan next year. Even though your medications don't change, the formulary may change. And the formulary may still cover your medicines, but it now may be much more pricey to cover your medications. And so you may want to look around for another plan to cover your medications. And then one other thing we want to talk about is IRMA. That's the Income Related Monthly Adjustment Amount, IRMA. These charges apply to both your Part B and your Part D for you and your spouse when they turn 65. And IRMA, the Income Related Monthly Adjustment Amount, is calculated based on the taxes that you filed 2 years ago. Right now, those IRMA charges are very hard to appeal, and there's only certain reasons that are allowed for those numbers to be adjusted. One of them is if you're a business owner and you sell your business and you get that windfall of that sale from the business, that is one of the reasons that you could appeal your IRMA amount. And when we're done, I'm going to post in the chat box a desk reference guide that has the information about IRMA, and we'll see exactly what those charges are on that desk reference guide. Right now, for Part B, the adjustment amounts range from $74 per month to $444 per month, depending upon where your income is. That's just for Part B, as in boy. For Part D, as in drugs, that amount ranges from $1,370 to $8,580. So it's real important that you are aware of what those IRMA amounts are, because that's going to also potentially be an additional expense that you will have to cover in addition to your Part B, your supplement, and or Part D. I know there's a lot there, and it's alphabet soup. I totally get it. But rely on your financial planner, Cody or Jennifer, or reach out to someone that you know is a licensed agent that you trust. And if you don't know anybody, we're happy to assist you. So let's talk about Social Security. Social Security, as Cody mentioned, is not going to be the be-all end-all for you once you retire. It's not a one-size-fits-all strategy. Everyone is different, and you must plan to optimize your benefits. And there's some terms you need to be aware of and types of benefits that you need to be aware of, as well as marital status, employment status, and earnings with Social Security contributions. And we're going to talk about those things here in just a moment. So why you need help. Most Americans don't optimize their benefits. And if you call Social Security multiple times, you'll get multiple answers each time. The Social Security agents that you talk to cannot really give you a strategy. You would need to contact your financial planner and have their assistance and talk with them about how to do that. You may also want to talk to a tax planner to see how your benefits may be taxed. There's more than 11,000 people retiring every day. And Social Security, like I said, is prohibited from giving advice on how to claim. And there's not a lot of reliable sources out there for you to find out about your benefits. So please choose wisely and choose carefully. Average monthly index earnings, or AIME, is the indexing or the adjustment of inflation for the past 35 years of earnings when averaged. COLA, I'm sure many of you are familiar, that's the cost of living increase. Normally, your Social Security benefits are adjusted each year for the cost of living increase, anywhere from 2.5% to 4%. Your FRA is your full retirement age, and that's when benefits are paid out at 100%. Your primary insurance amount, that is your monthly benefit when you claim at your full retirement age. And then FICA, or Federal Insurance Contributions Act, is actually the name of the act that dictates that you are contributing 6.2% and 1.45% for Medicare, 6.2% for Social Security, and your employer is also contributing or matching those amounts as well. So in total, you end up saving 15.3% for your Social Security and your Medicare. I know it's alphabet soup. Rely on somebody that you know and trust to help guide you through this process. So Social Security is more than just a retirement program. It's a steady stream of income that you have adjustments for cost of living increases. It's based on the highest 35 years of earnings. And it's available for married, divorced, widowed, and also children of someone who may be passed. And then it's also available for disabled persons. And then those who are self-employed also have to pay Social Security and Medicare taxes as well. This year, the maximum taxable earnings is $176,100, as Cody mentioned. And this amount is adjusted each year slightly for inflation. So in other words, if you make $200,000, your taxes for Medicare and Social Security stop at $176,100. So that's why you would have an IRMA, because you didn't pay anything over and above that 176. So let's talk about full retirement. Full retirement age is, for anyone that is born in different years, varies. And each year it changes. So if you were born in 1960 or after, your full retirement age right now is age 67. As Cody mentioned, they could change that date and that age. There might be a slight uprising, or could be a major uprising, but they could change that to help the trust fund last longer. But you can see the different retirement ages for everybody based on their birth year. Keep in mind that your full retirement age is when you receive 100% of your benefits. Now you may decide to wait and add 8% each year to age 70. So you could retire with 124% of your benefit. Each year you wait, after age whatever it is, you add 8%. Most people these days are retiring at age 67, but if they wait until age 70, their benefit can grow to 8% each year, an additional 8% each year that they wait. So you could have a spouse benefit, survivor benefit, ex-spouse benefit, and you could also have dependent benefits. So it's real important, the third one there, the ex-spouse benefit. So if you were married for 10 or more years and you have not remarried before the age of 60, you can go ahead and claim benefits on your ex-spouse account. And that does not affect their benefits, nor does it affect their spouse's benefits if they have remarried. So you can see the benefit chart there on the left. When you're at age 62, you're only receiving 70% of your full benefit, depending upon when you are born. Keep in mind too, once you start claiming, your benefit is frozen at that level. So for my example, I'm 61 this year. I was born in 64. So next year, if I was to claim my benefits at age 62, my benefit will be frozen at that dollar amount. And when I turn 67, it's still going to be that 70% amount. It never adjusts, even though I get older. So that's why it's so important to be careful about when you decide to pull your benefit, because you're locked into that benefit the rest of your life. And you can see then after your full retirement age, you increase 8% each year, and that money is compounded annually. So that's quite a chunk of money for someone who could wait 3 years. Claiming consideration. So as we've been saying, your benefit increases 8% each year after your full retirement age. But at age 70, you do have to begin your benefits. Cost of living increases are typically 2.5% to 4%. Life expectancy. People are living much longer than they ever did before. There's new advances in medicine, and things that were thought to be incurable are now cured, and people are living to well into their 80s and even into their 90s, and you just never know. There's more chance now that you would outlive your sources of other income. And I hate to say this, but women do live longer than men. They're also historically the lower wage earner, and likely they're going to be the survivor of a married couple. And so it's important, if you have a spouse that passes, you can stop your benefit and jump onto what they were getting if their benefit is higher. And actually what happens is you may continue your own benefit, and you'll get a second benefit that will add up to make what he was getting or she was getting. So the box there, Social Security, is truly a case of what you don't know can hurt you. So it's important that you follow the direction of your financial planner or your tax advisor, or find a trusted financial person that you can rely on. If you pull your benefits early, at age 62 or anywhere between age 62 and your full retirement age, and you're still working, you have to be careful, because you can only earn $23,400. Once you earn $23,400, every dollar is withheld, $1 is withheld from every $2 that you go above that $23,400 limit. I'll say that again. You lose $1 of every $2 in your benefit once your earning exceeds $23,400. The year that your full retirement age is, that limit increases to $62,160. But you lose $1 for every $3 above $62,160. The month you have your full retirement age and beyond, there's no limit. You also want to consider, if you're the major earner in your family, how could this affect your spouse's benefit or dependent benefits? The last comment on there is beware of overpayments. Not too long ago, 60 Minutes did a special, if you will, on the earnings and the folks that were collecting overpayments, and they got an ugly surprise in their mailbox, because Social Security found out that they were being overpaid. And as it says there on that second bullet, the overpayment could be caught years later, and you would end up owing not only the the mistake of payments, but also there's some penalties and interest that are accrued there as well. So Social Security's mistake is unfortunately your responsibility. So just a couple final thoughts. Who's depending upon your benefit? Your spouse, your dependents if you're disabled? What is your spouse's benefit going to be? When do you want to stop working? What's your life expectancy? What's your spouse's life expectancy? Have you had any chronic illness or any type of cancer? All of those things can affect your life expectancy. These are just some of the questions you want to think about and ask yourself. And like I've been saying right along, find someone you can trust and ask for help. A CPA, a CFA, CFA, let me start again. It's all alphabet soup. A CPA, a CFP, or an RSSA.
All right, we want to thank everyone so much for joining us on this presentation. We do understand y'all might have some questions about Social Security or Medicare, or maybe just some of the changes that have happened here recently. So if you do have any questions, please feel free to reach out to either myself or Lee. We'd be more than happy to help you. Hope everyone has a great day.